Very good afternoon. It's in fact pride and pleasure to get the honor of OHSF Mumbai branch Oration. My first thanks and respect and regards to the Tamil Nadu branch of IAOH for nominating me for this oration. My sincere thanks, respect and regards to the President, Central Council and the judges for selecting me for this oration. I feel very happy because in 2002, when I stepped into the career of occupational health by getting graduated in Central Labour Institute, our batch was very fortunate to get exposure to the IAOH Mumbai branch Golden Jubilee Conference. It was under the organizing secretary leadership of Dr. Shyam Pingle. It was a 3-day event at Taj where we had a wonderful exposure, and apart from that, we were taken to one of the best of the occupational health centers and occupational health services in Mumbai, particularly Atomic Power Plant at Trombay, Baba Atomic Research Center, Hardelia Chemicals, and Indian Oil refineries in Mumbai, where we saw the best of the occupational health services. With that passion, started his career with the hazardous process industry of pesticide, fertilizer, and sanitary ware. I am very happy. It's almost 22 years after my graduation from CLI on occupational health. I am honored with this Mumbai branch oration. With this brief note, we are immensely benefited with IAOH national conferences and regional events to augment and expand our knowledge in the field of occupational health. It was in CLI Mumbai we were able to get the ILO Encyclopedia on Occupational Health and Safety from ILO Geneva. Our director imported it and gave it to us. We still use it as a resource material to find out the best practices across the globe. In fact, today's topic I am going to deliver is on the dimensions of wellness, the expanded role of active medical officers and the dimensions of wellness for the health and safety of the workers. Yesterday there was a talk by a UK executive from Society of Occupational Medicine. If you see the website for learning material and resource material, it says resource material for occupational health and well-being professionals. Maybe our profile of occupational health is also having an additional responsibility of well-being professionals. There are plenty of deliberations yesterday and day before yesterday about the WHO's healthy workplace model, and also we have global best practices into dimensions of wellness and health. With this brief note, I would like to start my presentation on dimensions of wellness. I know it's very difficult to hold you between the lunch and the talk, but I like to make it interesting. But my request is, please see my nutrition PPT, then take a decision on the lunch. We all know the definition of health, but what is wellness? Wellness is not the absence of disease, illness or stress, but the presence of optimal physical and behavioral health, purpose in life, active involvement in satisfying work and play, joyful relationships and happiness. It is the duty of the active medical officer to maintain and improve the dimensions of wellness for the worker to enjoy the feeling of well-being. This is the very famous slide, the illness and wellness continuum. If you see here, we are all in the neutral phase, many of us. No symptoms, nutrition inconsistent, exercise sporadic, health is not a high priority. This is a phase of false wellness. But how do we go down the lane to the right side for high level of wellness? That is the optimal health, 100% function, continuous development, active participation, and wellness lifestyle. There are plenty of global best practices on examples of wellness wheel. Some of them are from the National Wellness Institute, USA, and one more from the Australian Institute of Wellness, Australia. And of course, when we achieve optimal dimensions of wellness, ultimately we have the sense of well-being. That is what we all strive for. Why wellness program? What are the wellness program objectives? We have to establish the significance of wellness program, educate management on the benefits of productivity and the cost of its loss due to illnesses, establish necessary steps to implement and maintain a successful wellness program, establish a method of testing the success of wellness program, because management wants metrics. What is the outcome? What is the return on investment? How much percentage has improved? What is the percentage of compliance? So it's very, very important not to run successfully a health promotional program or a wellness program, but the outcome has to be measured. So metrics is very, very important. I think with the era of digital health, we can definitely calculate the metrics. Assess which wellness program is best for the work environment. What is the reason for this wellness program? There are so much of technological advances, increase in stress levels, increase of workplace diversity, expanding work hours, high healthcare cost, and ultimately we should prevent the illness. Because so much of deliberations, even my previous speaker was talking about unhealthy lifestyle. The era of couch potato is creeping up. Everybody wants to sit idle, unhealthy lifestyle, obesity, poor diet and physical inactivity, which is the leading cause of death next to smoking. Unhealthy lifestyle costs can consume upwards nearly half of the company's profit. Cost of employees and employers in lost productivity, disease, disability, and death. Primary risk areas are smoking, lack of exercise, unhealthy eating habits, overweight and obesity, alcohol, now the substance abuse, drugs. The culture is creeping up, particularly the young trainees and apprentices getting addicted to drugs. Stress. So what is the benefit? We are utilizing the employees' work life because they spend more time on work rather than at home. So we utilize this opportunity to promote healthy habits to lower the business cost and to reduce workers' compensation cost, increase productivity, improve the health, and reduce the absenteeism. So why workplace wellness? It contains 6 pillars. Engaged leadership is very, very important at multiple levels. Strategic alignment of company's identity and aspirations. A design that is broad in scope and high in relevance and quality. We should have internal and external partnerships. My previous speaker told about return on investment of 7-1. Singapore statistics shows 4-5. I'm immensely happy I put one number less, 6-1. So the return on investment is very high. So the health programs should not be considered as a cost, but it should be treated as an investment. These are the 6 dimensions. I'm taking up one model, for example. This is by National Wellness Institute, USA. It incorporates the financial wellness into occupational wellness, physical wellness, social wellness, intellectual wellness, spiritual wellness, and emotional wellness. We can celebrate wellness weeks. Each day of a week, we can incorporate one particular dimension of wellness and celebrate. We have safety ambassadors, the field force which is there in each shop floor, taking up all the unsafe acts and conditions and reporting to the safety committee. Quality issues also are reported by quality marshals. So why can't we have wellness champions? We can have people from administration, human resources, facilities and operations. Role of wellness champions, they have to contribute and oversee the development of organization wellness programs, because as a single team, generally factories have a OHC team which is very, numbers are in single digit or double digits. So we should effectively utilize them. We have to provide guidance and leadership to these wellness champions, communicate the wellness activities, events and messages to the staff, be a champion of healthy living in your organization. Plenty of health topics can be taken up for these wellness programs, nutrition program, physical activity programs, tobacco and smoking cessation programs, weight management programs, injury prevention and ergonomic programs, cholesterol management programs. From the previous deliberation, we heard India is becoming the capital of heart disease. The hypertension management program, women's health and men's health, financial wellness programs, stress management, time management programs, allergy programming, mental health and stress management programs, and cancer prevention programs. I would like to take up each dimensions of wellness and focus on key inputs. When you take up occupational dimension of wellness, you choose a career that you are passionate about. I am very poor in mathematics, very good at biology, so I was passionate. And after the Mumbai branch Oration conference in 2002, it was a more passion for me to take up the field of occupational health. So you find a career that you are passionate about, personal interest and values should align. On personal growth and development, many organizations send you on-duty or on-board training programs, qualifications. So build new skills and look for opportunities to grow. For financial security is concerned, we should have financial discipline. Make a comfortable living for you and your family. Do not build debt, pay off bills, financial investments for long-term security. We had a wonderful PDC on the first day where there was a wonderful session on financial wellness for occupational health professionals. So the message has to be passed on down the line. Ergonomics at the workplace, all musculoskeletal disorders, radiculopathies because of faulty ergonomics is becoming an occupational health disease. So how do you control? As an occupational health physician, engage and deploy tools like Ruler, Reba, and also OHSF has got an online assessment of ergonomics. So all those can be effectively implemented. The benefit of workplace ergonomics causes decreased injury risk, increased productivity, increased efficiency, and decreased lost work days. This is very, very vital. I would like you to focus on healthy diet. Consume healthy diet and align correct nutrition, lean protein, fruits and vegetables, whole grains, healthy fats, be physically active, abstain from substance abuse, get enough sleep and allow your body to heal from sickness, injury. My focus on today's topic is about the healthy diet. We have a wellness dining in our factory where from a mass health checkup we have identified 1,200 people who are obese, overweight, pre-diabetic with high waist circumference and diabetes, pre-diabetes, diabetes, heart issues and dyslipidemia. Our wellness dining does not use oil at all and it does not contain rice. You have a vegetable salad, you have a fruit salad, you have a soup, buttermilk is available, only millets are used for cooking, brown bread, chapati. This is the menu. It's called a wellness dine and everybody knows the nutrition, the food groups, the food pyramid, everybody is aware. On the inaugural session we had a liver specialist who spoke about SGPT level should be somewhere around 20. But in muscle checkup we invariably find SGOT, SGPT levels, many people have fatty liver. Grade 1, grade 2, grade 3. Grade 3 fatty liver, there is no space between the liver and the diaphragm. The liver is enlarged. When you take a high glycemic food, it's a load. You require only 2,200 calories if you are a doctor. Any excess calories more than that, 4,000, 5,000 calories gets converted into fat and it's being stored in your liver. Invariably we find people with now muscle checkup shows grade 3, grade 2 fatty liver, SGOT, SGPT somewhere around 60, 70, 80, deranged liver function. Now ultrasonography is gone. They want to go for a fibro scan. When you go to fibro scan, you find F1, F2, F3. F3 is advanced fibrosis where it is not reversible. F1 is reversible. Now ubitocolic acid has come. It is being marketed to reverse F2 fibrosis to F1 fibrosis. Hepatologists say you have to reduce at least 15 to 20% of your body weight for your fibrosis to return to normalcy. When it is advanced fibrosis, F3, invariably it is cirrhosis. And you know the side effects of cirrhosis, portal hypertension, esophageal varices, ascites. In his clinic, out of the 100 patients, 40 patients are with the liver problems. When you do a muscle checkup, it is a common finding to find grade 1, grade 2, grade 3 fatty livers. obesity. So we don't have rice in our wellness canteen. We don't have tubers, no sweets, no aerated drinks, and we try to minimize sprouted and vegetables and low calorie fruits. So this is how. Avoid high glycemic foods. This presentation we use for our diabetic patients, overweight and obese patients, to educate them on healthy dining. So the scale goes up. Green is with low glycemic index, the red is with high glycemic index. If you consume a high glycemic index, there is a big spike in your blood sugar levels. Rainbow diet, colored vegetables, the phytonutrients, particularly rainbow colored fruits and vegetables. If you don't take on a daily basis, these fibers help you to avoid constipation, anal fissure and piles, and phytonutrients prevents from cancer. If you don't take a rainbow diet, 7 colored vegetables and fruits, you will end up taking rainbow colored capsules and tablets. Choice of fruits. This presentation is particularly for people who are overweight, who want to reduce their calorie intake, obese people and diabetic people. Say no to this. These are all high calorie fruits. On the right side, take a portion size. When you keep a fruit salad in a cup, when you send employees to diet canteen, take 1 cup of fruit salad which contains either guava, kiwi or muskmelon or watermelon or apple. These are low calorie fruits. But when you take 2-3 cups, then the very essence gets destroyed. So the portion size, how much you eat, is very, very important. So no to this choice of even sweet corn and green peas seem to increase the triglyceride levels. And the right side, yes. Instead of having a usual breakfast like this, try to go for a suggested breakfast with methi, oats, wheat or dal mixed dosas. Instead of using a diet with so much of idlis and coconut chutneys, study shows no fasting, no feasting. Never skip your breakfast. If you skip your breakfast, you tend to overeat in the evening and towards the night. Your metabolism is such. Having protein in the morning diet, we have a dual breakfast with protein in the diet. Sundal is in the morning. When protein rich diet is there, it prevents the craving for food towards afternoon and evening. Always have protein in your diet, and you should have a sambar with vegetables and decrease the portion size. Rather than having usual breakfast like this, suggested to go for wheat, tomato, onion, curry leaves, coriander leaves added. Upmas will be better. Avoid coconut chutneys and groundnut chutneys which are high in cholesterol. Preferably go for vegetable chutneys. Vegetable chutneys are tomato chutneys, onion, coriander, curry leaves and mint chutneys. This is a healthy choice. We should never have evening snacks like this. Suggested are sprouted, green grams, sundal, bale, all these are healthy choices. Your plate should be like this. Half of the plate should be vegetables, quarter plate should be rice or chapati, and the other half should be protein and a low fat curd. Milk, there are 3-4 varieties. That is cream milk, skimmed milk, toned milk and skimmed milk. Standardized milk. So preferable to choose double toned milk or a skimmed milk. When you go to movie theaters, you find common options. That is, smoking causes cancer and alcohol is injurious to health. But the concept is changed. I was speaking to an oncologist. He says alcohol is also proved to be a carcinogen, and it has been included in the carcinogen list by International Agency for Research on Cancer. You find so much of problems with alcohol. I don't want to list, but you can go through. And we were very fortunate when IAOH Delhi branch organized in 2016 or 17 in Habitat Center, they brought Director General of Tobacco Control. We were thinking tobacco contains only 4,000 chemicals and 69 carcinogens, but the Director of Tobacco Control from Delhi office clearly told it is proved and research shows it is 6,000 chemicals and 69 carcinogens. It is very, very notorious. very pathetic to see people smoking without being aware that it contains 69 carcinogens. It is our duty to educate our factory employees about the harmful effects of alcohol. I had one patient during a muscle checkup, his GGTP was 750, normally 60. Because of chronic alcoholism, it was 750. We sent him to de-addiction center. After 4 weeks of intensive counseling and inpatient admission, it returned to 250. Now, with all de-addiction treatment and liver correctives, it is returning to normalcy. Anybody who lies that he is not consuming alcohol, check his GGTP. That reveals whether he is alcohol habit or not. So, kindly educate employees. There are plenty of scope. United Nations Health Days are there. May month we have this World No Tobacco Day. Make it a mega event. Use this opportunity to educate people. Not alone smoking, whether it is cigar, whether it's BD, or a smokeless tobacco, or tobacco chewing, everything is equally harmful. Sleep deprivation. Sleep deprivation is very, very common. And in fact, many of the common sleep hygiene guidelines, I would like to take 1 minute of your time where we should follow the sleep hygiene guidelines. Develop a ritual of going to sleep. Sleep in silence and in the dark. Do not eat much before going to sleep. Never use caffeine drink or smoking before sleep. And try to exercise at least 2 to 3 hours before going to sleep. And the first sleeping pill I prescribe for my factory employees is walking. Because that improves the quality of sleep, gives you a deep sleep. Please give up caffeine beverages towards the evening. Sleep on a firm level of bed. No couching. The bed should be firm. When you get up with mild low back ache also, when you get up in the morning, your pain should be relieved. Never sleep on a spring mattress because firm bed itself is a treatment for low back ache. So and go to bed and wake up at the same time. And of course, for shift workers, there was a wonderful deliberation in one of the, again, Habitat Center neurologists spoke about the shift workers and the sleep habits. When they complete third shift and go back home, they should wear goggles or an eye patch, not to look outside the window, look at the sun. They have to return home directly, not to go to shopping for vegetables and provisions, not to drink coffee or not to smoke. Make the room dark, temperature comfortable, noise free, then sleep. So this is the advice we give for, I had one factory employee in my previous organization who had a sleep-wake cycle disorder. He never sleeps, he could not sleep at all. Then we had to intervene a sleep medicine specialist, put him on medication, and he had to sleep. So we have to educate on sleep hygiene guidelines for shift workers, and we ourselves have to follow the sleep hygiene guidelines. When you Google it, you'll find all this material, not less than 6 hours and not more than 8 hours. And exercise. When I ask the patient what exercise you will do, I go for walking, swimming. But that is not sufficient. Aerobic exercise is cardiovascular endurance. Walking, cycling, swimming, running, jogging. That's for the cardiovascular health. When you want to build a muscular endurance, you should go for weight training exercise. The American Heart Association has given a guidelines on physical activity guidelines for adults. 2.5 hours of aerobic activity or a cardiovascular exercise in a week. That is at 30 minutes per day, at least 5 days a week. And for muscle strengthening, they have to do at least 1 or 1.5 hours in a week. And of course, do not forget, we should also do stretch exercise for all the joints. Neck, back, knee, elbow, wrist, everything. We have a shop floor and office area stretch work exercises for 10 to 15 minutes. Our physiotherapist goes, everybody gets up, he communicates, he does the exercise, stretch exercises, and everybody follows. So we have to do aerobic exercise or cardiovascular exercise, cardiovascular endurance, anaerobic or muscle strengthening. Then we should also do the stretch exercise, because neck pain, back pain, wrist pain, all these are common. If your muscles, joints and ligaments are not strengthened enough, you will face all these problems. Because once musculoskeletal diseases are established, it's very difficult to treat. It will affect your mobility. I do not know how many people above 45 or 50 are able to squat.
So we have 2 minutes.
Yes. And in fact, the exercise gives plenty of endogenous morphines, the happiness effects. The social is Where dimension, be positive contributing factor in the community and the environment around you. Be a volunteer, philanthropist, and support others. In relationships, be in a positive relationship with your life partner. Strengthen your family and friends around you and grow a positive personal network. Intellectual, challenge yourself to think outside your comfort zone. Look for opportunity in educational challenges. Try new things. Diversify your world around you. Trigger points, identify potential problems, work to solve the problems and not to dismiss the problems, strive towards overall wellness. Spiritual, mindfulness, be tolerant to other worlds, views and beliefs, whether it's religion, belief or spiritual practices. Yoga, wonderful tool for the integration of mind, body and soul. The benefits of yoga are mentioned, everybody knows. Meditation is a must. Yesterday we had on deliberation the advantages, the brain waves, both the hemispheres are wonderful. Just try 15 to 20 minutes of meditation. It will give immense benefits. Emotional, you should understand what are the emotions, anger, happy, sad and frustrated. Understand that being optimistic and positive living and positive thinking is very, very important. Always build trust and respect others. Stress management knows prevention and management. And please, we have to change the mindset. The way we look, there is a different perspective to any problem or any stress. And regarding the wellness questionnaire and assessment, this is the assessment tool. So from center it's 1, it reaches up to 10. You see in which dimension you are lacking. In occupational you are 10, in physical you are 6, in social you are 4, in intellectual you are 10. So try to improve physical and social, see that it reaches up to 10. This is a self-questionnaire which can be beautifully done. And regarding, many organizations are asking for what is the wellness index? What is the health index of your department? What is the health index of your division of your factory? How do you calculate it? Framingham Heart Score gives you 4 risk factors: smoking, hypertension, dyslipidemia, and diabetes. This is only an example. When you have a wellness index, a person with red band, who is having more than 2 or 3 risk factors, please review them frequently. Amber colored, 1 or 2 risk factors follow-up is required. And green band, no risk factors, he is healthy. So the wellness program success factors depends on top management and employee support, maximize participation, incentives, and frequent communication, and make it a fun. Workplace friendly policies, support program goals and objectives, and of course, program variation, paper, web-based and seminars. Please engage family. Family participation is very, very important. Wellness coaching is important. And evaluation reporting will give the program a grand success. And evaluating outcomes, short-term and long-term. Short-term is participation, satisfaction levels and quarterly surveys, testimonials. We had wonderful testimonials from GSK presentation day before yesterday across the globe. So much of testimonials from the beneficiaries of the beneficiaries. And in fact, long-term, healthier and happier organization, reduce in healthcare, health risk factors, productivity, return on investment, changes in biometric measures. That's what is very, very important. And ultimately, we want a happy human. Thank you. I think I have done some justice to the oration. Thanks a lot.